Management of vertical malocclusions. Deep bite describes a condition of excessive overbite where the vertical measurement between the maxillary and mandibular incisal margins is excessive when the mandible is brought to habitual or centric occlusion. In normal overbite, the upper incisors slightly overlap the lower incisors. It is usually expressed in millimeters. The overbite is measured quickly by marking a short line on the labial surface of the lower incisor with a sharpened head pencil. The distance from the incisal edges to the marked is then measured with the use of a Bowley gouge or divider. Normal value of overbite is between 1 to 3 millimeters. The overbite also can be described as percentage of the mandibular incisor crown length overlapped by the maxillary central incisors. 5 to 20% of overlap of the mandibular incisor is considered normal. Deep bite affects the facial aesthetics, impairs the dental health of the individual. Excessive overbite where the lower incisors hit the lingual of maxillary incisors or gingival tissues results in periodontal destruction. There will be anterior migration of maxillary anterior teeth, wear of mandibular incisors, spacing in maxillary anterior region. It can lead to problems in the temporomandibular joints. Diagnostic aids required are clinical examination, intraoral radiograph, study casts, and lateral cephalogram. Deep bite can be divided into dental and skeletal deep bite following proper diagnosis. Skeletal deep bite may be due to malrelationship of alveolar bones and or underlying mandibular or maxillary bone. Deep bite of dental origin is a type of bite in which the problem lies in the dentition. The various causes for deep bite are described in the table. The dental deep bite could be due to premature loss of permanent teeth causing lingual collapse of anterior teeth, anterior tipping of posterior teeth, infraocclusion of posterior teeth due to tongue thrusting, supraocclusion of anterior teeth. Occasionally, deep bite is caused due to large-sized teeth. A skeletal deep bite can be caused by horizontal growth pattern, short anterior facial high, posterior facial high is long, upper facial high, lower facial high is reduced, less interocclusal clearance, convergent rotation of skeletal jaw bases. Features of skeletal deep bite include deep curve of Spee in mandibular dentition, reverse curve of Spee in maxillary dentition. When there is maxillary excess, we can find the gummy smile. Lower facial high is less. The primary determining factor in treatment planning is to decide whether deep bite correction is achieved by intrusion or extrusion. There are 5 important factors to obtain stable relationship: lip relationship, vertical facial relationship, occlusal plane, interocclusal space, and age of the patient and duration of treatment. Consideration of lip relationships include when lips are incompetent, we can observe deep bite with large interlabial gap, increased distance between incisal edge of incisors and upper lip, or gummy lip. In these cases, bite opening by intrusion of anterior teeth is done. With competent lip, we can observe deep bite with less interlabial gap, normal or reduced distance between incisal edges of incisors and upper lip. The treatment is extrusion of posterior teeth. Consideration of vertical facial relationships. Extrusion of 1 mm of posterior teeth results in increase in anterior facial high by 2.5 mm. Therefore, extrusion mechanics has to be avoided in patients with increased facial high or high mandibular plane angle. In patients with class 2 division 2 malocclusion, extrusion of posterior teeth may be the treatment of choice. When we have increased anterior facial high or increased FMA, treatment should be intrusion of anterior teeth. When we have reduced anterior facial high and reduced FMA, treatment should be extrusion of anterior teeth. Consideration of the occlusal plane. One of the objectives in correction of deep bite is to obtain a flat occlusal plane. Flat occlusal plane or leveling of curve of Spee can be obtained by intrusion, extrusion, or relative intrusion.